Wonderful. Okay, yeah, thanks Danielle. Thank you everyone involved in GETA for inviting me here today. So I'm a senior clinical research assistant at the University of Melbourne. Yes, I've worked with Ingrid Sheffer for many years and Sam Berkovic. And I've just moved into a new role that's the program manager of the Natural History study, which is part of the Centre for Research Excellence that Emma mentioned yesterday. So today I'm switching tack a little bit and sharing some work that focuses on the reason we're all here today, so severe genetic epilepsy, the developmental and epileptic encephalopathies. But this was work that we looked beyond the seizures, so we wanted to focus on the range of other conditions that individuals can have. So normally we would leave the thank yous to the end, but I'm switching things around here because quite a few of you in the room probably contributed to these research projects, and quite a few people that were here yesterday and might have been listening online. So we realised it would have taken precious time away from your family, so we're really grateful that you all participated in this work, and it's really wonderful to be able to come back and share these findings with you. So the two other people that I need to thank, you may know them or you may have spoken to them. So Michaela and Eve were medical students. They each spent a year with us completing these projects. They're both doctors now, and they both said how helpful that their time was working on these projects and how it will inform their careers and their future care for families with genetic epilepsy. Okay. But before I jump into the work that I wanted to present, I did just think I should provide the definition and explanation of that lovely mouthful jumble of words, the developmental and epileptic encephalopathies. Love it. So these are many different types of epilepsies that can be considered DEEs, but they all have these characteristic features. So that is, there is an underlying impact on development that exists there. And then that is overlaid over the top with the epileptic encephalopathy. So that's the frequent or sometimes near continuous epileptic activity that's happening in the brain, and that's further disrupting the learning and developmental processes even more. And so Mark and others have spoken about, you know, the more than 100 genes, if not more than 150, I think now, that cause the DEEs. But the picture is complicated. Again, Mark alluded to, you know, that the same genetic cause can cause very different clinical features, even different types of epilepsy. And so we're moving into a time now when many people and many families are receiving sort of two names for their diagnosis. So that is, you know, it could be, if you find a cause, a gene name, so SYNGAP1 DEE. But then you might also be receiving an epilepsy syndrome name as well, so something like myoclonic atonic epilepsy. And the goal from the work that we're doing and many other clinicians and researchers is that it is for every patient to have both of these diagnoses or both of these names. And we've got the little guy in the video here, and he has KCNQ2 developmental epileptic encephalopathy. Okay, so moving into the work, and as you're all very much aware, seizures are just, you know, one piece of the complicated puzzle that is the genetic DEEs. But children and adults also experience many other conditions in addition to seizures or epilepsy. And these other conditions can impact virtually any body system. So movement could be impacted, sleep can be disrupted, behaviour, development, learning and emotions can be affected. Feeding and breathing may need assistance, appearance, growth, muscles and bones may develop differently. The way hormones behave and the way the heart developed can all be impacted. And so the medical term that is used for these other conditions is comorbidities, or more recently that's moving into multi-morbidities. So you might hear doctors or you might hear doctors use that term or read in the medical and scientific papers these terms, but I'll keep referring to them as other conditions today. But you know this best, that all of this is painting a really complicated picture for families to live with, for carers and clinicians to support and to treat, and for us as researchers to study. And goals for us as researchers, so we're trying hard to change the way that research about genetic DEEs is done. And we want to do this because we want clinicians to have the evidence to inform changes to their practice. We want government and funding agencies, such as the NDIS, to have the evidence to support broader support needs of families. And as we've heard, as we're moving towards trials of precision medicine therapies, We want to make sure that researchers are looking at more than just seizure counts to determine whether a therapy is effective and works. Okay, so now to the actual work that we did and that you guys participated in. So what did you guys say about the other conditions that your children and adults with genetic DEEs are experiencing? So Michaela, one of the medical students I mentioned, she designed a questionnaire to answer this. And her questionnaire included questions about movement, about sleep, behaviour, development, speech, autism spectrum disorder, about feeding, about surgeries, and about quality of life and the impact of the DEE on the family. We invited 620 families into our study, and 181 wonderful parents and carers completed our questionnaire. And I do want to just make a note here that this is a fantastic response rate. So in research like this, we generally expect around half of that. So it's just a privilege to work with such a wonderful population of keen and engaged families. All right, so what did we find? So most families reported that their child or adult with a genetic DEE also had at least one other condition. So that's all the boxes here in green. Although we can see from this graph as well that many reported that their child or adult with genetic DEE has multiple additional conditions. So, most families are managing an awful lot of symptoms, an awful lot of therapies, specialist appointments, tests, and investigations. So I also mentioned that we asked families questions about quality of life and the impact of the genetic DEE on their family. And this is because we were interested to know what the impact of these other conditions might be, given the focus historically has been so much about seizures in the DEEs. And so you as families know this best, and we as researchers presume that of course these other conditions would impact quality of life. And we did show this statistically. So the families who reported no other conditions, so shown here in the orange boxes, you can see that they're all grouped towards the bottom of the graph. And this represents better quality of life scores that were reported by the families. And this is compared to the families who reported one or more other conditions shown here in the green. We can see they the boxes gradually get closer to the top of the graph, which represents reports of a greater impact on quality of life. And interestingly, the data showed that the impact on quality of life did not keep getting worse, so that those boxes didn't keep reaching further up to the top of the graph as the number of other conditions increased. So we can see here the families who reported between 2 and 5 other conditions, they're all positioned sort of similarly on the graph. And we think that this might be, but I'd be interested to hear from you guys too, that might be because so many of these conditions impact the same domains. So, for example, learning problems, mobility issues, and a hearing impairment. They're 3 different other conditions, but they're all impacting reduced independence, for example. And we think that these might all have similar impacts to quality of life, and maybe that's why just having 2 is enough to set you over the threshold there. Okay, so what were these other conditions that families reported in addition to seizures? And I'm sure you can infer quite a lot of these. And intellectual disability was the most common here, reported in 90% of families, and language delay in 71%. So motor disorders in 76% of individuals, and hypertonia in 11%. And then autism spectrum disorder, families reported that in 63% of their children and adults with genetic DEEs, stereotypies in 31%, attention deficit hyperactivity disorder in 29%, aggression in 12%, and then on top of this, other behavioural concerns in a large 57%. Sleep issues were reported in 44% of families, feeding issues in 33%, and assisted feeding in 12%. And then 72% of individuals had had at least 1 surgical procedure in their lifetime. So something else we were interested to look at was, well, how does this compare to previous research? So there's unfortunately not any other really good big papers with big cohorts that look at all of these different comorbidities. So Paul Michaela had to sift through 633 papers and reporting on over 13,000 children and adults with DEE to try and calculate all of these different frequencies. She did this amazingly and found that the percentages in our study were quite similar to those reported previously. So we can see that our study in the blue bars there are matching fairly well with the previous research with the red bars. But there are some differences, so I will talk about those. So we can see here that there's far more people in our study who had autism spectrum disorder, but fewer people who had hypertonia or aggression or assisted feeding. And so something that we're thinking this could be due to is because there's often a bias in the papers that are published to include individuals that maybe have more severe symptoms, whereas the people that are involved in our research have a really broad range of epilepsy types. So one aspect that came out of the questionnaires in our study, but which wasn't reported in the previous research, and that was the high rate of surgeries in children and adults. And so, as you might expect, that these procedures did include those for epilepsy, such as vagal nerve stimulator implantation or plastic surgery for seizure-related injuries. But these procedures also included things that people that without genetic DEEs might not require surgery for. So things like dental examinations. And so we hear from you guys that this just adds further logistical, financial, and psychosocial resources that are required of families. The other thing to mention with surgeries is that children and adults with DEEs can also have some more complicated anaesthetic requirements and an increased risk of post-operative complications. So, it's really easy to see how quickly even just one additional condition out of the ones we looked at can add so much more complexity and have enormous impacts on family life. So something else that we hear has enormous impacts on family life is, of course, sleep. And we do hear often that when a child or adult with a genetic DEE isn't sleeping, no one in the house is sleeping. So we did want to delve into this a little bit more. So this is where our other medical student, Eve, and her work comes in. So for Eve's study, we had 47 parents and carers complete our questionnaire about sleep. This questionnaire was a validated scale for diagnosing sleep problems, along with some specific questions that we developed about sleep and the genetic DEEs. So 44% of families reported that their child or their adult with genetic DEE currently has a sleep problem or a sleep issue, but 82% said that they had experienced, their child or adult had experienced a sleep issue at some point in their life. So this is a really common concern that should be really high on the list for doctors to ask about and for researchers to investigate. This little graph down here just shows Eve's calculations that children and adults with genetic DEE, they spent on average 10.5 hours sleeping each night. Most were sleeping between 7 and 12 hours a night. But we can also see that there are children and adults with genetic DEE sleeping as little as 3.5 hours a night, which is hardly anything. We wanted to tease out what could be influencing this total nightly sleep time. And so the only factor when we looked at quite a few was whether the person was taking a medication for sleep. So kind of counterintuitively, that those who were taking a medication for sleep actually slept on average 1.5 hours less than the children and adults who weren't taking a medication for sleep. So we know that melatonin, so sleep medication like melatonin, which you might have heard about, is really good at increasing total sleep time in neurotypical children. And we've heard from the families involved in our research that melatonin can be great for helping children and adults with genetic DEE fall asleep, but perhaps it isn't as good as helping them stay asleep throughout the entire night. Also, sort of counterintuitive and counter to what we expected was that children and adults with genetic epilepsy did not change their total sleep time as they got older. So instead, their sleep needs remained fairly similar across all the different age groups that were involved in our study. So co-sleeping was a common theme in response to Eve's questionnaire, and 58% of families reported that they shared a room with their child or adults with genetic DEE at least once a week. This was more likely in families where the child or the adult had a current sleep problem, or if rescue medication or ambulance services had been used in the previous year. And this completely matches the reasons that families did give for co-sleeping. So most frequently, the family said that they co-slept because of worry about seizures. 25% said that their child or adult just won't sleep without them. 15% co-slept because of worry about the sleep problems instead of seizures, and 13% co-slept for other reasons. So the different sleep problems that families described in this survey, very many, so 52% described frequent or these prolonged overnight waking periods. 40% described difficulties with going to bed or initiating and starting going off to sleep. 18% described an erratic or a disturbed sleep routine. 15% the sleep was disrupted because of seizure-associated problems. 11% reported daytime sleepiness, and then less frequent with things like early waking, night terrors and bedwetting, and breathing problems overnight. So lastly, I did just want to return to some of the other conditions that children and adults in the previous research had been reported as having. And as I mentioned, the way previous research has reported these conditions is a bit of a mess. So many papers will report just intellectual disability and focus on the seizures, or they might report some of the other neurological conditions without mention of any of the other body systems. So there's definitely room for improvement in the way that we're reporting these other conditions. But we did make a particular note about how frequently constipation was reported in families from the previous research. That was in 76% of families, so quite a lot. And I've just learned this recently when you become a new parent that you'll never believe how interested you can be about poo colour, shape and frequency. So that's maybe my new area and my new discovery for the year. But I guess with constipation, this is a condition that can be easily diagnosed, managed and prevented, but has some pretty serious consequences. Things like it can really worsen toileting behaviour, it can be quite painful, and there's some evidence to say that it can actually make seizures a lot worse as well. So all of this is really impacting quality of life. And we hope that by highlighting this finding, it will prompt doctors to inquire about constipation so that these issues can be improved. Okay, so I will just wrap up now and just share a couple of take-home messages that I hope you've all, this is all probably no news to you, but I hope it's nice to see it brought out in big group and big study cohorts. So we have the evidence from this research that other conditions are really common in children and adults with genetic DEEs, and they can be often quite severe. The impacts to the child or the adult themselves with genetic DEE are significant, but impacts to families are also enormous. And we've heard a bit and quite a bit yesterday about this multidisciplinary care that really recognises and responds to the range and severity of these conditions is really vital. And doctors should automatically be asking about these other conditions and then facilitating assessment and management as needed. And Mark mentioned and others have mentioned that 50% of people with genetic DEE have a known cause for their genetic DEE, and hopefully a known cause for which precision medicine therapies will start to be developed. And then the ultimate goal, obviously, is that these precision medicine therapies should treat the whole person and not just manage the epilepsy, but all of these other conditions as well. So we really want to make sure that these precision medicine trials measure the right sort of outcomes, taking into consideration the breadth and severity of all of these different conditions. So thank you. Thank you if there's anyone in the room who participated. We're really grateful. But obviously thanks to Ingrid, Michaela, Eve and the team at the Epilepsy Research Centre. And thank you, Geta, for having me today.